Welcome to the program. I'm your host, Neil Howard, here on Health Professional Radio. Glad that you could join us this morning. I'm going to have a conversation with Becky Nagy. She's Vice President of Medical Affairs at Guardant Health, and she's joining us to talk about a study led by Memorial Sloan Kettering Cancer Center concerning Guardant360. It's a liquid biopsy. Welcome to the program, Becky Nagy. How are you this morning? And thank you so much for taking the time.
Hi, Neil. Thanks. Very happy to be here.
Vice President of Medical Affairs at Guardant Health. Give us a brief background about yourself and then tell us how you came to be at Guardant Health.
Sure. So I have a background in genetics, formerly trained as a genetic counselor, which is a master's level, and worked in the academic setting for about 20 years, taking care of patients with hereditary forms of cancer, such as breast and ovarian cancer, and also doing quite a bit of work in translational research. And back in 2015, had the opportunity to move over to Guardant Health when we were still a very small startup company, have been there since then, and now leading the U.S.-based medical affairs team.
And what is the core mission of Guardant Health?
Guardant is a precision oncology company, and we're really dedicated to conquering cancer through the development of innovative blood tests. And we feel that generating vast amounts of genomic data is really going to unlock some of the secrets around how we can more effectively treat different types of cancers across all stages. The company started back in 2012 and launched our first CLIA certified test, which is called Guardant360, in June of 2014. And since that time, we've tested over 120,000 patients with metastatic cancer to help them identify the therapy that will work best against their specific cancer.
Now, there was a recent study published in Nature Cancer. What was that study about? And talk a bit about the findings.
Sure. So the study was led by Memorial Sloan Kettering Cancer Center, and it was a small investigator-initiated trial looking at the use of several different drugs, one called alpelisib, as well as letrozole or exemestane. And alpelisib is, at the time, it was a new PIK3CA inhibitor. So it targets specifically a pathway that we know is very important in the development of breast cancer. And if you look at that particular gene, PIK3CA, 45% of women will have a mutation in that gene that drives their cancer. And so because such a large proportion of women with breast cancer have a change in that gene, there was a lot of interest to develop a drug that would be able to target that pathway effectively. And so this study was a phase 1, phase 2 study of alpelisib, which is the PIK3CA inhibitor, plus or minus hormone therapy in women who have hormone receptor positive, HER2 negative metastatic breast cancer. And the goal was to really figure out if this drug combination even worked. But there were some secondary aims of the study, and this is where Guardant was involved, to look at could we determine not only the PIK3CA mutation being present or absent, but were there other genetic alterations that would confer either a sensitivity to that drug combination or resistance to that drug combination in patients receiving the therapy. One of the most significant findings from the study that the investigators noticed was there was a broad variability in how patients responded. And all patients coming in had metastatic breast cancer. All patients had a PIK3CA mutation. So this led the investigators to ask, why did some patients respond so well and others not at all? And they decided to use our test to further explore why patients may not have responded. And they found what we call resistance mechanisms or genomic resistance mechanisms that were identified by Guardant360 that played a role in why certain patients responded and others didn't. This is important because by identifying those resistance mechanisms, we can then develop even better drugs or a next generation of therapies that could overcome those resistance mutations and help patients respond even longer.
So this biopsy is identifying other mutations, thereby giving you the ability to better pinpoint the treatment. Is this being widely used, and why, if not?
So Guardant360 is being widely used across the country and actually the world. We've tested over 120,000 patients, as I mentioned earlier. So it's broadly utilized. I think we have a way to go still to have more physicians using the test. The cancer types where it's used most frequently are non-small cell lung cancer, some gastrointestinal cancers such as colon cancer and breast cancer. And within non-small cell lung cancer, one of the reasons it's very broadly used there is because there are over 15 different targeted therapies that target 7 different genes that carry mutations within them that drive non-small cell lung cancer. And so in that particular cancer type, comprehensive genomic profiling, whether it be by tissue or blood-based like Guardant360, is standard of care at this point, and it is included in many different oncology guidelines.
So this means that doctors can treat people more efficiently and have much better outcomes. I'm sure we're talking about quality of life and longevity. How is that? Have you seen that extended?
Absolutely. So targeted therapies in general result in longer overall survival for patients, as well as better quality of life. Typically, the side effect profiles of these targeted therapies are more mild compared to things like chemotherapy, longer overall survival, as I mentioned, but also just the ease of taking an oral therapy. These are usually pills that you can take from home, so you don't have to actually go into a hospital and be hooked up to an infusion machine to receive the therapy. So lots of different benefits of a targeted therapy versus more standard therapy such as chemo.
So what would you say is the future of Guardant's technology, especially as far as Guardant360 is concerned?
Yes, I think the future is broader use across different cancer types. So as more biomarkers are identified and more drugs are available, the utility of the test will just increase. Just within the last week, there were 2 targeted therapies that received FDA approval in the non-small cell lung cancer setting. So essentially, overnight, the utility of our test increased because we include those particular mutations on our panel, and now those patients have yet another option if they carry those mutations. And so as the space moves forward in terms of identifying new targets, Guardant360 will be well positioned to help those patients get onto the best therapy.
Can our listeners go to a website with?
Yes, our website is guardanthealth.com.
Great. Well, Becky, I thank you for joining us, and I'm hoping to talk again with you soon.
Great. Thanks so much for having me, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Transcripts and audio of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure to subscribe to our YouTube channel at youtube.com, Health Professional Radio.